Good day, everyone, and thanks for joining the webinar that will introduce you to UICC members' engagement opportunities at the 2018 World Cancer Congress. My name is Mina Georgic. I'm the Congress and Events Manager at UICC. As you can notice, I will be your Frenchy voice today, and I will take you through the exciting program that we have put together for you in Kuala Lumpur. The session should last 30 minutes, including Q&As at the end, so please feel free to post them through the chat as I speak. A recorded version of the webinar will also be available after the live presentation. So if I start with the first slide, I would say, and give you an overview of what the Congress is about. So the 2018 Congress will take place from the 1st to the 4th of October in the Kuala Lumpur Convention Center. This year's event has been themed Strengthen, Inspire, Deliver, with the aim to reflect the task we face to reduce the global cancer burden, emphasizing once more that collective action is required if we want to succeed. Indeed, according to a WHO survey from 2015, 87% of countries have cancer plans. 68% of those were considered operational. 36% of the world is still not covered by an effective cancer plan. So these figures are under review, actually, but it means that more than ever, it's still time for our community to stay mobilized and take advantage of the global commitments, such as the newly adopted cancer resolution by member states at the 2017 World Health Assembly to foster change. And indeed, this is exactly what the Congress is about and strives to contribute to. As a recognized international conference which encourages effective knowledge transfer and best practice exchange, the event aims to strengthen the participants' action and impact at the time being and on national, regional, and global scales. For a whole week, the Congress brings under one roof 3,500 cancer control and public health experts from more than 150 countries, which means putting forward the incredible breadth of expertise, cultures, and also backgrounds of our community. So if you are an oncologist, a researcher, a fundraiser, a cancer control planner, a nurse, a health carer, a radiotherapist, or an executive, the Congress is the place to be. It also proposes a very rich agenda that features the latest successful interventions across the full spectrum of cancer control. The Congress involves inspiring speakers and global influencers. So, for instance, in the past editions, we had the former President of France, Mr. François Hollande. We also welcomed Her Majesty the Queen of Spain, Mr. Michel Sidibé, the UN AIDS Director General, Professor Ian Fraser, who is the inventor of the HPV vaccine against cervical cancer, or Professor Atul Bute, who is the director of the Institution for Computational Health Science and an expert in big data. The Congress finally offers educational schemes that increase participants' abilities and skills and actually empowers them to do a better job today. So I guess that's why 96% of participants would recommend the Congress to a colleague, and 85% of participants rated their Congress experience in Paris, which is the last Congress, from very good to understanding. The top three factors in attending, in deciding to attend are: 1, networking and developing new partnership; 2, listening to renowned international experts; and 3, learning and sharing best practices and new methods which are applicable to their own settings. So now that I've set the stage, let's discover what actually this concretely means for you as a UICC member. So if I go to the next slide, which shows a recap of your benefits and engagement opportunities, you will see that they range from networking to involvement activities. I will detail them throughout the presentation, but as you can notice, there are many opportunities for you actually to play your part at the Congress in Kuala Lumpur. The offer has been designed to empower you as an individual, as a team, and as an organization, and help you better respond to today's challenges and changing contexts. To give you a better idea of how you can take advantage of those benefits, we have combined them into 3 main pillars, which also echo the purpose and objectives of the Congress. So on the next slide, you can see how you can maximize your benefits to make impact. The first pillar is about sharing best practices and empowering others. And you can achieve that through, of course, the main Congress program, the plenaries, the big debates, the abstracts, the discussion cafes, the global village and its pavilions. The second pillar focuses on networking, influencing and fostering collaboration. This includes the World Council Leaders Summit, the UICC members' regional meetings, the UICC Awards and General Assembly, and also all the networking and social events. The third pillar proposes to build capacity and knowledge transfer through master courses and the CEO program mainly. I will now detail all these suggestions and opportunities for each pillar. So if we start on how you can share best practices and empower others, the first opportunity that comes up is, of course, the Congress Multidisciplinary program, which has been structured around 5 tracks: prevention, screening, healthcare systems, empowering patients and caregivers, and finally, fundraising. You will be able to choose to participate in no less than 90 interactive sessions that feature more than 400 speakers from about 80 countries and that have been selected for their novel practices in cancer implementation science. The examples that are listed on the slide provide a very small sample of the wide range of topics that will be discussed in Kuala Lumpur. So I would really encourage you to browse the online program on the Congress website and start actually identifying the session that interests you and that could bring value to what you do. I would also like to take this opportunity to thank all our members, partners, the wider community, the program chairs, as well as the track co-chairs for their contribution to the program and their submissions through the call for sessions that we ran last year, which resulted in shaping such a dynamic and varied program. The next slide takes us through the plenaries and big debates, which always rank among the top 5 Congress highlights. The aim of the plenaries and the big debates is to spark innovative thinking. So this year we will welcome top-notch speakers on stage, such as Dr. Arora, Dr. Rajagopal, Dr. Kirsty Sword-Gusmao, Dr. Frank Chalupka, and Dr. Rob Moody. They will, each of them, their profile are available on the Congress website. Each of them will provide new perspectives on major issues in cancer control and public health. So, for example, Dr. Raj is a renowned palliative care physician, and he will focus on palliative care as a human right for cancer patients during his plenary talk. Dr. Chalupka is an internationally recognized economist. He will cover the impact of economic, policy, and environmental influences on health behaviors, with a particular focus on taxation across tobacco, unhealthy food, and alcohol. With regards to the big debate, we have chosen 3 main topics that will confront diverging views and should create meaningful discussions. The debates should also prompt the audience to vote for the best convincing arguments through the Congress app. So the first topic on debate 1 is HPV vaccination trumps early detection in decreasing cervical cancer mortality. The aim here is to find, I would say, a balance with regards the benefits of vaccination over establishing screening programs in countries that currently lack them. The second debate will focus on how cancer societies can engage with pharmaceutical industry without compromising their independence. The common scenario here is that when cancer societies are approached by patient groups or by pharmaceutical companies directly to advocate for specific drugs to be added on the list of publicly funded drugs. So in those cases, for instance, how do cancer societies ensure they maintain their independence and be seen as independent in the eyes of government? The third debate is under still construction but should focus on complementary medicines, which are a big topic for instance, the region, the Asia-Pacific region, where, of course, the Congress is taking place. The next opportunity for you to take an active role are the abstracts. You can submit your paper by the 31st of March. Abstracts are a self-contained, short and powerful statements that describe a larger work. There are always great ways to increase your value and profile within the community. Share your knowledge and research findings with a wider audience. At the Paris Congress in 2016, we had 600 abstracts that were presented. This year, we are looking for innovative scientific studies and impactful advocacy fundraising campaigns. We also have a novelty, which is the Abstract Hub, that is actually supported by the Canadian Partnership Against Cancer and ASCO, and which has been designed as a one-stop shop which aims to facilitate the interactions between the presenter and the participants whilst being easily accessible for all delegates. Also this year, the accepted abstracts will be featured online as a supplement in the Journal of Global Oncology. The accepted abstract will be presented under various formats depending on their scoring. So we will have what we call abstract orals, rapid fires, or e-pod poster presentations. This information is again available on the Congress website. If you are keen on submitting an abstract, here are a few tips to facilitate your submissions. So for the policy and advocacy reports, what we suggest is that you outline the background and context, the aim, the strategy and tactics that you used, the program process, the outcomes, and what was learned. For the scientific studies, we would advise you to outline the background, the objective, the methods, results, and then conclusions. And finally, for the fundraising report, we would advise you to outline the amount raised, the background and context, the objective, the strategy and tactics, again, that you used, the process, as well as the cost and returns, and finally, the lessons learned. So don't forget to submit your abstract by 31st of March. The next slide takes us through another opportunity for you to interact with the other delegates and also share your knowledge and expertise at our famous discussion cafés, respectively named NCD Café and the Meeting Café. The cafes are two of the most bustling areas of the Congress. They are held in a casual setting, and each cafe stages lively interaction between the speakers and the audience. So this year, for instance, at the NCD Cafe, a number of key topics will be addressed in the context of cancer and NCDs, ranging from healthy lifestyles and universal coverage to national mobilization and access to quality cancer care. As for the meeting cafe, participants will be able to meet and discuss with the plenary speakers. The program will be also available soon online, again on the Congress website. And finally, the next slide gives you also the opportunity to secure your space in the most animated area of the Congress, which actually is the Global Village and its pavilions. So the Global Village is more than just an exhibition space. It's actually the heart of the Congress. It's a buzzing area which enables you to easily raise your organization's profile amongst the Congress participants whilst making meaningful connections. The Global Village usually welcomes about 60 exhibitors from all over the world and encourages cultural diversity and intercultural dialogue. Its African, French, or Latin American corners also offer local and regional insights to visitors. So as a UICC member, you benefit from 10% discount, including full delegate badges. You also have the opportunity to secure your booth by 15th of April and for a chance to get it for free of charge if you enter our special draw. This year, the Global Village will also host the Patient Group Pavilion, which was launched for the first time in 2016 at the Congress in Paris, and gained incredible popularity. So this is why we are reconducting the initiative this year. The Patient Group Pavilion aims to strengthen the patient voices and welcomes patient support groups to discuss and exchange on issues that are affecting more and more patients and their families. So the 2018 program actually includes 48 presentations, which mainly involve UICC members, and will cover a great variety of themes such as women's contribution to clinical trials research, how to manage both financial conflicts and patient care conflicts, the use of new technology, or how to debunk cancer myths and cultural stigma, for instance. Again, the program is available online, so please feel free to consult it. The Global Village will also welcome what we call the Wellness Pavilion, which should provide an insight into complementary medicines and stress relief exercises, such as traditional Chinese medicine, massage, Reiki, or laughter yoga. So we have now ended the chapter on how you can share best practices and empower others. So let's see now how you can network, influence, and foster collaboration during your week in Kuala Lumpur. So, and let's start with the World Cancer Leaders Summit. The summit is part of UICC leadership program, and as such is mainly open to top executives. So it means chief operating officers, general directors, general secretaries, depending on the title used, of UICC full member organizations. As a high-level policy forum, it brings together 350 global key decision makers and encourages timely debate on emerging issues related to cancer. The summit is traditionally held in partnership with WHO, IARC, and IAEA. So, for instance, last year's summit in Mexico welcomed high-level dignitaries such as Her Majesty Queen Letizia of Spain. We also had the President of Mexico, the President of Uruguay, the Ministers of Health of Ghana, of Mexico, of Spain, the Vice President of Argentina. It was a huge success, and it's worth noting that UICC members counted for more than one-third of participants. As an immediate outcome of the event, the National Cancer Institute of Mexico and summit host has officially been appointed to coordinate the development and implementation of a sustainable national cancer control plan. So this year we are expecting the same caliber of participants to discuss the summit's theme, Cancer Treatment for All, and address the need for countries to further invest in early detection, treatment and care to contribute to the 25 by 25 NCD targets. The invitation to CEOs of our UICC full member organizations will be sent out in the coming weeks. Another occasion for you to be involved are the UICC members' regional meetings that are shown now on the slide. So the regional meetings are dedicated platforms for UICC members to discuss new approaches and practices at regional levels in line with the Congress capacity building and educational objectives. So we will have 6 regional meetings, one for Africa, one for Asia Pacific, one for Eastern Mediterranean countries, one for Europe, including the Commonwealth of Independent States, one for Latin America, and one for North America, including global collaborations. The novelty of this year is that as a UICC member, you can send your collaborative initiatives and be selected to present it at the UICC members meeting for your region. The call runs from until 15th of April, so I would encourage you to take action now and submit an example of an innovative model of engagement or which also has the potential to be replicated in other countries or settings. The detailed eligibility and selection criteria are available on the regional meetings page on the Congress website. The benefit of doing that is that you will be able to present your case study to a large audience and your peers from your region and be recognized as a prominent voice in cancer control in your region, and also receive high exposure through the Congress and UICC social media and online platforms. The next slide shows also another opportunity for you to play an active role, which is the UICC General Assembly and during for the awards. So the General Assembly is UICC's supreme governing body and takes place every 2 years in conjunction with the Congress. It allows our members to oversee and provide input on UICC's mission and activities. So in that context, UICC full members are entitled to approve the financial accounts and elect the UICC Board of Directors and the President-elect for the next 2 years, which means 2018-2020. This year, the General Assembly will be held on the 2nd of October and will be followed by a networking reception open to all UICC members. We are also pleased to announce a new initiative, which are the UICC Awards. They aim to honor the significant contributions of our members in various categories. So there will be an award for advocacy. There will be an award recognizing outstanding leadership with the CEO Award. There will be also an award for the best collaborative initiative, which is linked to what I mentioned earlier. There will be also an award recognizing exceptional fundraising campaigns. And finally, an award for the World Cancer Day spirit. The objectives of the UICC Awards are to, of course, empower UICC members and give them international recognition, but also to foster a sense of community amongst our membership organizations. The application process as well as the eligibility and selection criteria will be soon available on the Congress website. So again, please keep an eye. We will also regularly communicate about this initiative throughout our newsletters and social media. The call for application actually opens from April to June. The next slide shows also again another opportunity for you to socialize and have fun through our social events, which are always highly valued by Congress participants as excellent platforms to network and catch up with colleagues and friends. This year, you will also be able to feel the spirit of the Malaysian hospitality at the series of events proposed by the National Cancer Society of Malaysia and actually Congress host. So on the slide, you can notice that there are many available events and that you can take advantage of. If we start with the 1st of October, you will be invited to the welcome reception that will take place in the Global Village, and that will be followed by the Congress opening ceremony. On the 2nd of October, as a UICC member, you will be invited to take part in the Break the Ice Fast, which is an inventive networking exercise for UICC members and partners that was introduced for the first time at the 2016 Congress. And actually we had 250 members who were guided by a professional moderator on how to make easy and quick connections and still have fun. So the event was really successful, and this is why we are reconducting it this year. So let's see what the moderator comes up this time. On the 3rd of October, you will also be invited to what we call the Social Evening Malaysia in a Nutshell, and you will be able to enjoy a fascinating spectrum of the Malaysian cultures and traditions through craft activities, mini culture performances, and stall food. So I have now ended this section, and I will start with listing some opportunities for you to build capacity and knowledge transfer. If the next slide takes us through the master courses. The master courses offer a unique opportunity to acquire specialized knowledge and skills over a period of 3 months distant learning. The course also culminates in a day workshop at the Congress. In 2016, 250 participants took advantage of the master courses, and the results of the survey that we conducted post-course are particularly positive. 95% of participants learned about tools and gained skills applicable to challenges in real-world situations, and 100% of them would recommend a UICC master course to a colleague. So in terms of 2018 timeline, you can apply for a master course of your choice via the Congress registration system as of March, actually on Monday, until May. The second phase involves the selection of the participant by the course leaders throughout May. Then you will be able to start your online learning via the ICC campus between June and September. And of course, on the 1st of October, you will be able to attend the workshop at the Congress itself. The topics for the master courses are varied, of course. So the first one is about strengthening capacity of patient groups across the health system. The second one is building cancer awareness and prevention programs. The third one focuses on how to use the law and policy making for cancer prevention and control. And the last one is about creating fit for partnering organizations. There is a story which is quite interesting and shows the value and impact of the master courses. And it's the story of the founder of the Wishing Well Foundation in Thailand. He's a pediatrician specialized in hematology, oncology, and a scientist with expertise in molecular genetics. He participated in one of the previous master courses and had no particular expertise in financial and fundraising given his background. But he's a great example of the value that the courses can bring, because he was able to put into practice what he learned, and he partnered with a major donor and other organizations and actually was able to fundraise $100,000 for pediatric cancer. So it's a great example of how a researcher was able to go beyond his comfort zone and actually succeed and achieve more for the cause that he defends. So I would really encourage you to take advantage of this opportunity and again enroll on a master course, especially as also they are free of charge. They are also held as small, size classes, which facilitates peer learning and connections. Another opportunity, again, for our members to take part in the Congress is through the CEO program. The CEO program is running this year in conjunction with the summit that I talked about earlier, and is also dedicated to top executives of UICC full member organizations. The program was first launched at the 2016 Congress in Paris and rapidly gained momentum as more than 120 CEOs took part in the scheme. The program aims to facilitate the networking opportunities for senior executives across UICC membership, peer-to-peer learning, and access to relevant educational and training opportunities. So the CEO program at the 2018 Congress includes 3 dedicated lunchtime workshops, which are highly interactive 60-minute sessions. Each session is facilitated by an expert and provides a platform to review best practices and share participants' perspectives. The program also includes CEO relevant sessions handpicked from the main Congress program. And finally, it involves a private networking receptions. Personal invitations to CEOs of UICC full member organizations will be sent out in April. I've now given you an overview of the main engagement opportunities across the 3 main pillars. I'm conscious that I provided a lot of information, so I would suggest that to do a quick recap of some of the main points and immediate actions that you can undertake should you wish to play an active role at the Congress. So the next slide takes us through the registration fees. The table shows that depending on your country, you will benefit from up to 50% of registrations. Please also note that food and coffee during breaks are included in the registration price. As for scholarship, UICC members benefit from priority selection for travel grants, which are subject to the following criteria. So your organization needs to be registered in a low and middle income country as per World Bank classification. You are also encouraged to take an active participation in the Congress program, such as, again, submitting a successful abstract, be selected for one of the UICC master courses, or submit a collaborative initiative for one of the UICC members' regional meetings. The travel grant includes an economy return flight to Kuala Lumpur, 4-night accommodation, and a full delegate registration. The next slide takes us through the quick actions that you can undertake to participate in the Congress. So again, you can submit your abstracts, a scientific study or advocacy fundraising campaign report by 31st of March. As of March, you can join the dedicated program for CEOs to encourage peer-to-peer support and learning. And you can also sign up for a master course to gain specialized knowledge in a specific cancer control area. By 15 April, you have various opportunities to get involved. You can register a group, get 20% off registration, and be entered into our draw to win a half-day meeting room and a session with a professional photographer. You can be acknowledged on the app and in social media, and also you will be recognized at the opening ceremony if you are the largest group. You can also, by 15 April, reserve your booth and get 10% discount. Finally, again, by the same date, you are able to send your collaborative initiative and be selected to present at a UICC members meeting for your region, meaning Africa, Asia Pacific, Eastern Mediterranean, Europe, Latin America, or North America. So this is now the last slide, which gives again a recap, an overview of your week in Kuala Lumpur, including the key dates of some of the events. So the week starts on the 30th of September with the World Cancer Leaders Summit official dinner, which is by invitation only. The day itself starts on Monday, 1st of October, when you will also be able to attend the Master Course workshop and also participate in the Congress welcome reception and opening ceremony. The day will end with a dinner organized by the local hosts, and which is by invitation only. The second day which is the first Congress day, starts on Tuesday, the 2nd of October, with the icebreaker, which I also mentioned earlier, and which is a UICC members and partners networking breakfast. The day will also feature the UICC award ceremony as well as the General Assembly, and the day will end with the CEO program reception. On Wednesday, the 3rd October, you will be able to attend the cultural and social evening organized by the local host. And finally, the last Congress day, which is the 4th of October, we will have the closing reception for all delegates in the Global Village. So I hope that you have found this overview interesting and useful. I've talked a lot, but if you have any questions, I will be happy to answer them now. I can see that there are a few questions. Alors, let me check more in detail. Okay, I think these are more technical questions which have been resolved. So I guess that there are no particular questions, but here on the last slide you have my contact details. So feel free to drop me a note if you would like to know more or you need more details about what was presented today. I thank you a lot for your attention, and again, we hope to see you in Kuala Lumpur very soon. Take care and have a good day. Bye.